The silent morning habit that's destroying your gums. And nobody is talking about it. I want to start this story at the exact moment you open your eyes in the morning. You're still half asleep. The room is dim. Maybe the alarm just went off. Maybe your body woke you up on its own. It doesn't matter. What matters is what happens next. Because you don't think about it. You don't decide to do it. You just do it. You roll out of bed. You walk to the bathroom. You reach for your toothbrush, and then, like a machine executing a program it's run 10,000 times before, you begin to brush. Fast, hard, back and forth, maybe circular, maybe not. You're not really paying attention. You're thinking about work, about the day ahead, about the email you forgot to answer yesterday. Your hand is moving, but your mind is somewhere else entirely. 2 minutes, maybe less. You spit. You rinse. You look at yourself in the mirror for half a second and you move on. Done, clean, healthy, right? Here's the thing. I used to believe that too. And for the longest time, that belief protected me from seeing something that was happening right under my nose, or rather right inside my mouth, every single morning without exception. I want to tell you what I eventually discovered, because the moment I understood it, I couldn't unsee it. And I don't think you'll be able to either. The habit you never questioned. Let me ask you something. When did you learn how to brush your teeth? Think about it. You really think. You were probably 4, maybe 5 years old. Someone, a parent, a caregiver, maybe a dentist with cartoon posters on the wall, handed you a small toothbrush with a pea-sized amount of toothpaste and showed you what to do. And you learned. You practiced. Eventually it became automatic. But here's what nobody tells you. That automatic habit you built as a child, you've been carrying it into adulthood, into your 30s, your 40s, your 50s, largely unchanged. The speed, the pressure, the rhythm, the angle, it's all still running on the same unconscious program that was installed decades ago. And that program? For a lot of us, it has a flaw that shows up silently, slowly, progressively. And by the time most people notice it, the damage is already well underway. I'm talking about gum recession, and I'm talking about the way our daily habits, the ones we perform on autopilot every single morning, are silently accelerating it. The signals I ignored. I remember the first time I noticed the blood. It wasn't dramatic, it wasn't alarming, it was just a faint pink tint in the foam when I spat into the sink. I looked at it for a second, thought something vague like, huh? Rinsed my mouth and walked away. That was it. That was my entire response to a warning sign, and then it happened again the next morning, and the morning after that. Until eventually it wasn't even surprising anymore. It was just part of the routine. Brush, bleed a little, rinse, continue with your day. I want you to pause on that for a second, because I think a lot of people reading this will recognize exactly what I'm describing, not because it's unusual, but because it's terrifyingly common. We have normalized something that is not normal. Bleeding gums are not a minor inconvenience. They are not just sensitive gums. They are not something that happens to everyone. They are a physiological signal, your body's way of telling you that something in your oral environment is wrong. That tissue is being damaged. That inflammation is present. And most of us respond to that signal by ignoring it entirely and continuing to do exactly what caused it in the first place. But bleeding wasn't the only sign I was getting. There was the bad breath. Not the morning breath that everyone has when they first wake up. That's normal. It's just overnight bacteria buildup. No, this was something different. A persistent undertone throughout the day. A staleness that lingered even after brushing, after mouthwash, after chewing gum. Something that seemed to come from deeper than the surface. There was the tenderness, especially along the gum line. A slight soreness that I only noticed if I pressed my tongue against it or if something cold touched it at the wrong angle. There was the swelling, so subtle that I couldn't even really define it. just a slight puffiness, a difference in texture, a feeling that something wasn't quite right, but that I couldn't point to directly. And then, one day I looked in the mirror, really looked, and I saw it. My teeth looked longer, not dramatically so, not in a way that would have alarmed anyone else. But I knew my own mouth, and I could see that the gum line had changed. That the soft tissue that used to frame my teeth was no longer sitting quite where it used to be. It had pulled back, and that's when I finally started asking questions. What is actually happening inside your mouth? Let me explain what gum recession actually is, because I think most people have a vague sense of the term but don't really understand the mechanics. And understanding the mechanics changes everything. Your gums, the medical term is gingiva, are not just decorative tissue. They are a highly specialized, living, responsive biological structure. They form a tight seal around each of your teeth, protecting the roots, the underlying bone, and the deeper structures from bacterial invasion. They are, in essence, the first line of defense of your entire oral ecosystem. And like all living tissue, they respond to their environment. When gum tissue is healthy and the environment is balanced, it maintains its position firmly around the tooth. It doesn't bleed under normal pressure, it doesn't swell. It holds its shape and does its job quietly and efficiently in the background. But when the environment becomes hostile, when there is repeated mechanical trauma, when bacterial populations grow unchecked, when inflammation becomes chronic, the tissue begins to change. It swells first. That's the immune system responding, sending increased blood flow to the area, trying to fight off the threat. That's why inflamed gums bleed easily. The blood vessels are engorged and close to the surface. Then, if the hostile conditions persist, the tissue begins to recede. This is the gum literally pulling back from the source of irritation. It's a protective mechanism, in a way. The body trying to remove sensitive tissue from ongoing damage. But it creates a cascading problem, because as the gum recedes, it exposes more of the tooth root, which is covered not by enamel but by a much softer material called cementum. That exposed root is vulnerable to sensitivity, to decay, and to further recession. And here's the part that most people don't understand. Gum tissue, once lost, does not regenerate on its own. This is not like a cut on your skin that heals over in a week. This is not like a bruise that fades. When your gum line recedes significantly, those millimeters of tissue are gone. The only way to restore them is through surgical intervention, gum grafting procedures that are invasive, expensive, and that require significant recovery time. Prevention is not just easier than treatment. In many cases, prevention is the only realistic option for most people, and prevention starts with understanding what's causing the problem. The real culprit, what you do. Every morning here is what I discovered that changed everything for me. The single most common cause of gum recession in otherwise healthy mouths, in people who don't have severe gum disease, who maintain their dental appointments, who brush regularly, is mechanical trauma from brushing. Specifically, brushing too hard, too fast, and with the wrong technique. Think about it from the gums perspective. Every single morning and every evening, if you brush twice, that soft tissue is being subjected to repeated abrasive force. A toothbrush bristle pressed with significant pressure, moving rapidly back and forth across the gum line. Now multiply that by 365 days a year, then by 10 years, 20 years, 30 years. The cumulative effect is enormous. The gum tissue sustains what dentists call microtraumas, tiny injuries that each on their own are too small to notice, but that collectively over time trigger the inflammatory and recession processes I described earlier. And the cruel irony is this. The people who are most conscientious about their dental hygiene are often the ones who brush hardest, brush longest, and apply the most pressure because they genuinely believe that more effort equals more cleanliness, equals better health. In reality, they are accelerating the very problem they're trying to prevent. More pressure does not mean cleaner teeth. More pressure means more trauma to the gingival tissue. The plaque that causes cavities and gum disease is a soft biofilm structure. It does not require aggressive force to remove. It requires consistent, methodical, gentle technique. The bristles of your toothbrush, when used correctly, should barely deflect. If you look at your toothbrush after a few weeks of use and the bristles are splayed outward like a broom that's been used to scrub a floor, that is a direct sign that you're applying too much pressure. Your gums have been paying the price for that pressure, quietly, every morning, for years. The morning window. Why timing matters more than you think. There was another layer to this story that most people have never heard, and it has to do with timing. Here's something that oral health researchers have been studying for years. The state of your saliva and your oral pH changes dramatically throughout the night. While you sleep, your saliva production drops significantly. Saliva is not just a digestive aid, it is a critical component of your oral defense system. It contains antimicrobial proteins, it buffers acids, it washes away bacteria, and it helps remineralize your tooth enamel. When its production decreases during sleep, the oral environment shifts. Bacteria multiply more freely overnight. Acids accumulate. The enamel surface of your teeth, without the buffering protection of a healthy saliva flow, becomes temporarily more vulnerable, and then you wake up and the first thing you do is reach for your toothbrush. If you brush immediately before eating, before drinking water, you're brushing in an environment where the gum tissue is at its most vulnerable. Overnight inflammation, bacterial accumulation, and reduced saliva protection mean that the mechanical trauma of brushing is hitting tissue that is not in its optimal state. Some dental researchers suggest waiting at least 15 to 30 minutes after waking before brushing, or at minimum rinsing with water first to rehydrate the oral tissues, stimulate saliva production, and begin normalizing the oral pH. If you eat before brushing, there is an additional consideration. If you have consumed anything acidic, orange juice, coffee, certain fruits, the enamel surface is temporarily softened by the acid exposure. Brushing immediately after acidic consumption can accelerate enamel erosion. Waiting 30 minutes allows the saliva to neutralize the acid and for the enamel to reharden. These are not radical suggestions. These are evidence-based observations that have been in the dental literature for years. But somehow they never made it into the mainstream conversation about dental hygiene. We teach people to brush. We don't teach them when, how gently, in what motion, or what to watch for. And the cost of that gap in education is being paid, quietly, in gum tissue, in millions of mouths, every single day. The signs that something is wrong, right now. I want to pause here and talk directly to you, not in the abstract, but to you specifically reading or listening to this right now, because the odds are meaningful that at least some of what I've described sounds familiar. Maybe you've noticed bleeding when you brush and told yourself it was nothing. Maybe you've noticed that your teeth look slightly longer than they used to, that there's more tooth visible, less gum framing it. Maybe you've had recurring bad breath that mouthwash doesn't seem to fully solve. Maybe your teeth are more sensitive to cold or sweet foods than they were 5 years ago. Maybe your dentist has mentioned something about your gums, recession, inflammation, pocketing, and you nodded along and then filed it away in the back of your mind, intending to think about it more seriously later. Later never comes, not unless something forces it. I want to be very clear about something. None of these signs should be normalized. None of them are just part of getting older. None of them are inevitable consequences of simply having teeth in your head. They are signals. They are your body, and specifically your gum tissue, communicating that something in the current approach needs to change. The good news, and there genuinely is good news here, is that if you catch these signals early enough, the progression is not just manageable, It can be stopped. In some cases, early-stage gum inflammation can even be reversed. Tissue can restabilize and the recession process can be halted before it becomes surgical. But only if you act, and only if you understand what to act on. The link in the description below connects you to a practical resource that goes deeper into exactly what that looks like. A step-by-step guide built around what preventive dentistry actually recommends for protecting gum tissue and reversing early inflammatory damage. Click it and take a look. What you find there could change your morning routine in ways that matter far more than any toothpaste brand ever will. The technique nobody taught you. Let's talk about what correct brushing actually looks like. Not the vague advice of brush gently, but specific, actionable technique. The method most recommended by periodontists, specialists in gum health, for people with sensitive or receding gums is called the modified base technique. Here's what it involves. Hold your toothbrush at a 45-degree angle to the gum line, not perpendicular to the teeth, angled so that the bristle tips are slightly directed toward the gum rather than straight into the tooth surface. Apply almost no pressure. Seriously, far less than you think is necessary. The bristles should barely touch the gum. Their contact should be so light that you could almost brush a soap bubble without breaking it. Use very small, gentle, circular or vibrating motions. Not sweeping back and forth strokes across the gum. Small, contained movements that stay local to one or two teeth at a time. Spend more time. Most people rush through brushing in 60-90 seconds. 2 minutes is the minimum recommendation, and 2 minutes of gentle, methodical technique covers a lot more ground than 90 seconds of aggressive scrubbing. Then sweep upward for lower teeth or downward for upper teeth to move the loosened plaque away from the gum line and toward the biting surface. This technique is not harder than what you're currently doing. In many ways, it's easier. It requires less physical effort. But it requires the one thing that is in shorter supply during a morning routine: conscious attention. You cannot do this on autopilot. You have to be present for it. You have to slow down, even by 30 seconds, and actually think about what your hand is doing. That shift from automatic to intentional is, in my experience, the single biggest change you can make. What else is feeding the problem? Brushing technique is the biggest mechanical factor, but it's not the only one. There are several other elements of your daily routine that are either contributing to or protecting against gum recession, and most people have never connected the dots between these habits and their gum health. Your toothbrush. If you're using a medium or hard-bristled brush, you're adding unnecessary abrasive force. Most dentists recommend soft or extra soft bristles for everyday use. The cleaning effectiveness comes from the motion and coverage, not from bristle stiffness. A harder bristle doesn't clean better, it just damages more. Your mouthwash. Many commercial mouthwashes contain alcohol as a primary ingredient. Alcohol is an effective antimicrobial, but it also dries out the oral mucosa, the lining of your mouth, and disrupts the balance of your oral microbiome. Daily use of alcohol-based mouthwash can actually contribute to the chronic dryness and microbial imbalance that supports gum inflammation. Alcohol-free formulations are generally preferable for daily use. Your diet? High sugar intake is obviously a known factor in cavity development, but its role in gum disease is often underemphasized. Sugar feeds the specific bacterial species, particularly Streptococcus mutans, that produce the acidic byproducts responsible for both enamel erosion and gingival inflammation. Beyond sugar, a diet low in vitamin C and D and in omega-3 fatty acids creates systemic conditions that make gum tissue more vulnerable to recession and slower to recover from damage. Stress. This one surprises people, but the connection is well established. Chronic psychological stress elevates cortisol levels, which suppresses immune function and increases systemic inflammation. The gums are not isolated from that systemic inflammatory state. They are affected by it. People under prolonged stress tend to have worse gum health outcomes, independent of their hygiene habits. Additionally, stress is a major driver of bruxism, our teeth grinding and clenching, which puts enormous mechanical forces on both teeth and gum-supporting bone structure. Hydration. Saliva, as I mentioned earlier, is a critical protective mechanism. Saliva production depends on adequate hydration. Chronically dehydrated people, those who don't drink enough water throughout the day, tend to have reduced saliva flow, which means reduced buffering capacity, reduced antimicrobial protection, and a mouth environment that is more hospitable to the bacterial and acidic conditions that damage gum tissue. Smoking and nicotine products. The connection between smoking and gum disease is one of the most thoroughly documented relationships in all of dentistry. Nicotine constricts blood vessels in the gums, reducing blood flow and impairing the immune response. Smokers develop gum disease at dramatically higher rates than non-smokers, and their gum tissue heals more slowly after damage. Even more insidious, nicotine's vasoconstrictive effect masks bleeding. Smokers' gums often don't bleed even when severely inflamed, which removes the early warning signal that might otherwise prompt them to seek help. The bigger picture. This is about more than your teeth. I want to step back for a moment and talk about why any of this actually matters beyond aesthetics. Yes, gum recession is visually noticeable. Yes, sensitive teeth are uncomfortable. Yes, bad breath is socially awkward. These are real problems worth addressing on their own terms. But the connection between oral health and systemic health is something that modern research has been revealing with increasing clarity over the past 2 decades, and it is far more significant than most people realize. The bacteria responsible for gum disease, particularly Porphyromonas gingivalis and Treponema denticola, don't stay neatly contained within the oral cavity. When gum tissue is inflamed and compromised, these bacteria can enter the bloodstream, and once in circulation they have been found to contribute to conditions far removed from the mouth. The relationship between periodontal disease and cardiovascular disease is one of the most studied of these connections. Chronic oral bacteria in the bloodstream trigger systemic inflammatory responses that are believed to contribute to atherosclerosis, the buildup of plaque in the arterial walls that underlies heart attack and stroke. People with severe gum disease have measurably elevated markers of cardiovascular inflammation. The connection extends to diabetes. Gum disease and diabetes have a bidirectional relationship. Uncontrolled blood sugar creates conditions favorable to gum inflammation, and gum inflammation in turn makes blood sugar control harder. Managing one helps manage the other. There are emerging connections to Alzheimer's disease. Researchers have found DNA and proteins from Porphyromonas gingivalis in the brains of Alzheimer's patients, a finding that has generated significant scientific interest around whether chronic oral infection may be a contributing factor to neuroinflammation. Pregnancy outcomes are also linked. Studies have shown that women with severe gum disease have elevated rates of preterm birth and low birth weight infants, likely due to the systemic inflammatory burden. I'm not sharing this to alarm you. I'm sharing it because the way most of us have been taught to think about oral hygiene as cosmetic maintenance, as cavity prevention, as a checkbox on the self-care list, is dramatically underselling what is actually at stake. Your gum health is not separate from your health. It is part of your health. It is connected to your heart, your brain, your metabolic function, your immune system. And it starts or ends every morning with how you pick up that toothbrush. The turning point, when I finally started paying attention, really paying attention, the changes I made were not dramatic. I didn't overhaul my entire diet overnight. I didn't start seeing a specialist every month. I didn't purchase expensive equipment or complicated systems. I slowed down. I changed the angle of my brush. I reduced my pressure to the point where it felt almost like I wasn't brushing at all, and then I kept it there. I switched to a soft, bristled brush. I started rinsing with water before brushing instead of going straight from sleep to scrubbing. I started noticing my gums, looking at them in the mirror, paying attention to how they felt, catching the early signs rather than dismissing them, and the results were not instant. Real biological change doesn't happen overnight, but within a few weeks, the bleeding had become far less frequent. Within a couple of months, the persistent tenderness had largely resolved. The sensitivity to cold, which had been slowly increasing, stabilized and then gradually improved. The gum tissue didn't reverse the recession that had already occurred. It's not how it works. But the process stopped progressing. The daily insult that was driving it forward was removed, and the tissue, given the chance to be treated gently, began doing what living tissue does when you stop damaging it. It stabilized, it strengthened, it healed, not because of anything magical, not because of a special product, because of understanding, because of changing a habit that had been running unconsciously for years, correcting it based on actual knowledge, and giving the body the conditions it needed to do its job. That is the power of informed awareness. And if you want a more structured guide to exactly what that process looks like, the specific steps, the techniques, the sequence of changes that make the biggest difference in the shortest amount of time, we've put together a comprehensive resource available at the first link in the description. It brings together what preventive dentistry and gum health research actually recommend in a format you can begin applying immediately. Click and take a look. The invisible epidemic. Here is the part of this story that I find most striking, not from a personal perspective, but from a population-level one. Gum recession is extraordinarily common. Studies suggest that some degree of gum recession is present in the majority of adults over the age of 40. Many researchers put the figure above 50%. In older populations, the rates climb higher, and yet it is one of the most under-discussed topics in mainstream health conversation. We talk endlessly about cavities. We spend billions on whitening products. We debate the merits of different toothpaste brands. We worry about our children's orthodontic alignment. But the quiet, progressive, structural damage being done to the gum tissue, the tissue that literally holds our teeth in place, that protects the roots, that is the foundation of the entire oral architecture, it receives almost no attention until it becomes a crisis. Part of this is the nature of the condition itself. It is slow. It is painless in its early stages. It doesn't announce itself the way a toothache does. It doesn't look dramatic in the early going. It just quietly progresses, millimeter by millimeter, year by year, until one day someone looks in the mirror and realizes that something fundamental has changed. Part of it is also the culture of normalization I mentioned earlier. When bleeding gums are common, they start to feel normal. When sensitivity increases gradually, it feels like aging rather than damage. When the gum line retreats slowly enough, the change is easy to miss. But common is not the same as normal, and inevitable is not the same as unavoidable. Millions of people are waking up every morning and unknowingly feeding this process. They are doing it with the best of intentions, trying to take care of their health, trying to do the right thing. They have simply never been given the information they need to do it correctly. That information exists. It has existed for decades. It lives in dental schools and periodontology journals and in the offices of specialists. It just hasn't been translated clearly enough into the morning routines of ordinary people. That's what this conversation is about. That's what I hope you take away from this. What you can do starting tomorrow morning. Let me leave you with something concrete, not a product recommendation, not a miracle solution, just real evidence-grounded steps you can begin applying the next time you pick up a toothbrush. Step 1. Slow down. Add 30 seconds to your brushing time and spend that extra time moving more deliberately, more consciously, with more attention to what your hand is actually doing. Step 2. Reduce your pressure by at least half. If you're unsure whether you're pressing too hard, place the brush against your palm and apply the pressure you'd normally use, then reduce it until it barely bends the bristles. That is closer to correct. Step 3. Change your angle. Tilt the brush toward the gum line at approximately 45 degrees. Direct the bristle tips toward the margin where tooth meets gum. Use small, gentle circular motions rather than long horizontal strokes. Step 4. Look at your gums, not just your teeth. Spend 10 seconds after brushing just observing the gum tissue. Is there redness, swelling? Is the line where your gum meets your tooth where it was 6 months ago? Awareness is the first intervention. Step 5. Drink water before you brush. 1 full glass. This rehydrates oral tissue, stimulates saliva production, and begins rinsing overnight bacterial accumulation before you add mechanical force to the equation. Step 6. Check your toothbrush. If the bristles are splayed and bent after less than 3 months of use, you're pressing too hard. Replace it and use its condition as ongoing feedback about your technique. None of these steps are hard. None of them require expense or dramatic lifestyle change. They require only attention. Attention applied to a moment in your day that you have been moving through on autopilot for years. And for a full, structured approach that goes beyond these basics, one that addresses the deeper patterns driving gum recession and gives you a clear methodology for protecting and restabilizing your gum tissue. The resource at the first link in the description is where you'll find it. We've made it as accessible and actionable as possible because this information shouldn't stay locked away in clinical language that most people never encounter. Click and see what's there. The moment that changes everything. Here is the strangest part of this whole story. The moment I learned what I've shared with you today, something irreversible happened. I couldn't brush my teeth unconsciously anymore. That sounds like a small thing. It isn't. The automatic morning program, the one I'd been running since I was 5 years old, had been interrupted. I'd introduced awareness into a space that had previously been on autopilot. And once that awareness was there, it couldn't be removed. Every morning when I reach for my toothbrush, there's now a moment of genuine thought. A brief but real check-in, angle, pressure, motion, gum line. It adds maybe 45 seconds to the process. 45 seconds that have, over time, changed the trajectory of my gum health in ways that I expect will matter for decades to come. That is what information does. That is what understanding does. It converts unconscious habits into conscious choices, and conscious choices repeated become better habits. The morning routine you've been running doesn't have to run the same way forever. You can update the program, you can install new information, correct the error, and let the new pattern take hold. Your gums are living tissue. They are responsive. They are not beyond help. They are waiting every single morning for you to make a different choice. And now, having heard this, you can. If this resonated with you, if something in here shifted the way you're looking at your own routine, subscribe to this channel. Because this is exactly what we do here. We find the habits that run quietly in the background of your life, the ones that feel invisible and harmless, and we bring them into the light, not to overwhelm you, not to add to your anxiety, but because understanding is the beginning of change. And change, even in the smallest details of a morning routine, compounds into something that matters. See you in the next one. The first link in the description contains a practical guide to gum health and preventive care. Click it and take a look.